Today is Tuesday, March 31st, 2020. Coming up next on Roland Martin Unfiltered, latest in the COVID-19 pandemic. The president of the American Medical Association will join us right here on the show. 12 employees of Florida prisons have tested positive for coronavirus. We'll talk about what needs to happen for the prisoners. Lawmakers are calling for racial data in COVID-19 testing. We discussed it on yesterday. Also, Albany, Georgia is in the top 5 cities for coronavirus cases. We'll talk to the coroner of Albany, Georgia. Plus, Donald Trump wants to suppress your vote to keep Republicans in office. Yeah, he actually said it himself. And a federal appeals court rules that the records for a 1946 mass lynching case will remain sealed. And plus, we'll continue our tribute to Reverend Dr. Joseph Lowery. It's time to bring the funk on Roland Martin Unfiltered. Let's go.
He's got it. Whatever the biz, he's on it. Whatever it is, he's got the scoop, the fact, the find. And when it breaks, he's right on time and it's rolling. Best believe he's knowing. Putting it down from sports to news to politics. With entertainment just for kicks, he's rolling. It's on go, roll, y'all. It's Roland Martin, rolling with Roland now. He's funk, he's fresh, he's real, the best, you know he's Roland Martin now. Martin.
All right, folks, glad to have you back on Roland Martin Unfiltered. Let's go right to the White House, where Dr. Anthony Fauci is addressing the media regarding the coronavirus. All right, not sure if we have the audio. Folks, let's double check that, please. All right, not quite sure why we are not getting audio there. So, folks, if you could rectify that, please, and let me know. They are, first of all, I'm watching it live, and Dr. Birx, as well as Anthony Fauci, they're talking about the growth of coronavirus cases taking place in the United States, and they're showing exactly what it looks like. Let's see if we can go ahead and we're going to try to go back to the news conference in just a second. So let's see if we can go ahead and
one of the best ways.
pull that up. Give me 1 second, folks. Again, Dr. Birx, she's actually at the podium as we speak, again, talking about the actual, just give me 1 second, folks. She's talking about the actual what's happening there. Dr. Fauci is also speaking right now as well. And so I'm just trying to go to the White House Facebook channel, YouTube channel, so we can go ahead and pull this up. Again, you know.
I can't see the small.
Here we go. I think we got it right here.
But are we seeing deaths until June? I can't really.
This is June.
This is June. So we would still see problems and deaths in June.
It's a projection.
It's a projection, of course.
So, I mean, just getting back to what I said about the stepwise thing, deaths always lag. So you will be seeing deaths at a time when, as an epidemic, we're doing really, really well because the deaths will lag.
Dr. Fauci, should Americans be prepared for the likelihood that there will be 100,000 Americans who die from this virus?
The answer is yes. We need, as sobering a number as that is, we should be prepared for it. Is it going to be that much? I hope not. And I think the more we push on the mitigation, the less likelihood it would be that number. But as being realistic, we need to prepare ourselves that that is a possibility, that that's what we will see.
A very short period of time for that to happen.
Right.
Can the country handle that in such a short period of time, within a couple of months?
You know,
50,000 a month.
You know, it will be difficult. I mean, no one is denying the fact that we are going through a very, very difficult time right now. I mean, we're seeing what's happening in New York. That is really, really tough. And if you extrapolate that to the nation, that will be really tough. But that's what it is, Jim, and we're going to have to be prepared for that.
Yeah, I think because the model, that was from IHME. That's based and heavily laden by the data that has come in from New York and New Jersey and Connecticut. So, that can skew to a higher peak and more significant mortality. If all of the other states are able, and all the other metro areas are able to hold that case number down, then it's a very different picture. But you have to predict on the data you have, which is heavily skewed to New York and New Jersey.
Just one extra thing, getting back to that, that's really an important slide that Dr. Burke showed. The cluster of other cities that are not New York and not New Jersey. If we can suppress that from any kind of a spike, the numbers could be significantly lower than what we're talking about.
Yes, some cities that are not following these guidelines.
Right, and that's the reason my plea at the end of my remarks, Jim, that now is the time to put your foot on the accelerator, because that's the only thing that's going to stop those peaks.
And some of the cities are doing very well, as you see, very well at this early stage. But the number, the doctor said 100,000. The number is between 100 and 200,000, maybe even slightly more.
Who does it?
But we would hope that we could keep it.
Can we have the
under.
next slide or
Mr.
the
President.
slide after that? Just go, one more slide. Perfect, yeah, thank you.
Would you tell cities that aren't doing what, New York, New Jersey, Washington, the cities that have been taking charge in all of this, would you urge some of the cities that haven't been doing this, Mr. President, to get with the program?
Well, I would, but if you see New York, I believe the blue is New York. New York is having a much harder time than other of the cities. Certain cities are doing, actually, if you look down here, an incredible job. They were early, they were very, very firm, and they've done an incredible job. This is New Jersey, New York. This is...
you remember California and Washington State were down here, and they had some of the earliest cases.
But we're seeing places in Florida not doing what New York and New Jersey have been doing, what Washington State has been
But
doing.
they're doing very well by comparison.
Mr.
Mr.
President.
President?
Yes.
Could maybe direct the questions.
All right, as I told y'all, we don't take Donald Trump live because he lies far too much in these news conferences. And so do we trust Dr. Burke, Dr. Fauci? Absolutely. But again, anything that Donald Trump says in any of these briefings must be vetted, must be fact-checked, because he is prone to lie consistently in these news conferences. Folks, as of today, there are 174,697 confirmed cases of COVID-19 in the United States and 3 U.S. territories. At least 3,400 patients with the virus have died. That's 529 more than yesterday at this time, and more than the people who died in 9/11. 6,215 patients have recovered. New York Governor Andrew Cuomo continues his daily news briefing as he talks about how the hospitals in New York are fighting as best as they can not to be impacted by, fighting coronavirus and trying to stop as many people as possible from dying.
And the main battle is at the apex. We're still going up the mountain. The main battle is on the top of the mountain. That's where the main battle is going to be, the apex of the curve. And then we come down the other side of the mountain. We are planning now for the battle at the top of the mountain. That's what we are doing. Get a staffing plan ready now for the battle at the top of the mountain. Equipment stockpile now. We're gathering equipment that we don't need today because today is not the day of the battle. The battle is when we hit the apex, depending on who you believe, 14 days to 30 days from today. And also we need a social acceptance of the time expectation. We're all anxious, we're all tired, we're all fatigued. It's been all bad news for a long time. Our whole lifestyle has been disrupted. Everybody wants to know one thing: when is it over? Nobody knows. Well, President said by Easter. This one said by this. Nobody knows. You can have a hypothesis, you can have a projection, you can have an opinion, but nobody knows.
Cuomo also announced that the disease has affected a member of his own family.
Everyone is subject to this virus. It is the great equalizer. I don't care how smart, how rich, how powerful you think you are. I don't care how young, how old. This virus is the great equalizer. My brother Chris is positive for coronavirus, found out this morning. Now, he is going to be fine. He's young, in good shape, strong, not as strong as he thinks, but he will be fine. But there's a lesson in this. He's an essential worker, member of the press, so he's been out there. If you go out there, the chance that you get infected is very high. I spoke to him this morning, and he's going to be quarantined in his basement at home. He's just worried about his daughter and his kids, that he hopes he didn't get them infected.
All right, folks, let's go back to the news conference. Dr. Brooks is speaking.
So right now we're at about 4,000 deaths here in the United States. You're suggesting a spike of more than 90,000 deaths over the next few weeks. Do you have a demographic breakdown of the areas that are most at risk and where most of those deaths may occur?
Well, right now, and I think if you ask Chris Murray, he would say he's using the information coming out of New York and New Jersey and applying that to potentially other states having the same outcomes. I just want to say again, this yellow line, and this is all corrected per 100,000 residents. So this is normalized so we can compare apples to apples. This is still Washington State, this yellow. So they've been able to, for a long time of measuring cases, not have a spike. So it's possible, and we're watching very closely to make sure it doesn't have a spike. But that's what the people in Washington State are doing. This is what every community, Washington State early, about 2 weeks before New York or New Jersey. California, a week before New York or New Jersey. Really talked to their communities and decided to mitigate before they started seeing this number of cases. And now we know that that makes a big difference. Early, as Dr. Fauci said, if you wait till you see it, it's too late.
And again, do you have a demographic breakdown, Dr. Burks, of where these deaths may occur?
So there's a demographic breakdown that we've discussed before related to mortality. And it's as we're seeing in New York exactly what we saw in Italy. Very low mortality, not to say that young people under 30 or young people under 40 aren't getting ill. They are, but most of them are recovering. So the profile looks identical to Italy with increasing mortality with age and pre-existing medical conditions. And so that is holding in the same way. But what we're hoping is that through the work of communities, and again, it comes down to communities. This is communities deciding that this is important to them to not have the experience of New York and New Jersey. And I think, we are worried about groups all around the globe. I mean, I don't know if you heard the report this morning, there's 8,000 ventilators in the UK. If you translate that to United States, that would be like the United States having less than 40,000 ventilators. We have 5 times that amount. So, these are the things that everybody is having to face. And I think the United States is in an excellent position from our medical care position, but we don't want to have to test that system. We want this to be a much smaller epidemic with much smaller mortality.
Can I just follow up on the testing question real quick before we move on? So the testing numbers, I understand 1 million tests done, it's a big increase, but we were told there would be 27 million tests available by the end of the month. So can you outline where in the supply chain, where in the logistics chain are those other 26? Yeah, where are the other 26 million tests right now?
I think this is just for purposes of clarifications. There's a difference between sending a test that can be administered to a test being done. Because a month ago or more, the president brought together the top commercial labs in America and said, we need you to partner with us to create a brand new system that would rapidly process tests. We're now at 1.1 million tests, and we believe it's a fair estimate that we're testing about 100,000 Americans a day. That'll continue to grow. It'll continue to accelerate. But I think the misunderstanding early on was there were many tests being distributed, many test kits being sent, but under the old system, as the president's described it, the antiquated system, those were being processed in state labs or at CDC or in private labs on a very slow, methodical system that could only produce maybe 30 to 50 tests a day. But this new partnership that we have with commercial laboratories allows the progress we're making. But the breakthrough with Abbott Laboratories now moves to point of care, which means you're going to have devices and tests that people will literally be able to take at their doctor's office, at a hospital, at a clinic, at a nursing home, and have the results in 15 minutes.
So those 26 million tests we were talking about, were those tests under the old antiquated system? And
Yes.
now, so are we still even using those 27 million tests, or have we just completely moved on to the point
The
of
answer
care
is
tests?
yes, now
So
through the new system.
even today, which is, I have to say, coming out of laboratories and developed tests and worked on vaccines and then gone to the field to actually combat epidemics, it is disappointing to me right now that we have about 500,000 capacity of Abbott tests that are not being utilized. So they are out, they're in the states, they're not being run and not utilized. So now we have to figure out, how do we create awareness? Because sometimes when you put an early platform out, like our first platform out in the high speed was Roche. So you get that out, people get dependent on that, and then don't see that there's availability of other tests. So right now, there's over 500,000 tests sitting, capacity, that are not being utilized. So we're trying to figure out, how do we inform states about where these all are? How do we work through every laboratory association so they're aware? And how do we raise awareness so people know that there's point of care, there's Thermo Fisher, there's Abbott testing, and there's Roche. And if you add those together, that's millions of tests a
They're
week.
not being reported.
And they're not, and so those are the,
But they're not being reported.
or they're not even being used. So that's what's really, so that's what we're working on.
What's the reason for being used?
Because when people get used to a single platform, they keep sending it back to that lab. So it's getting in a queue to wait to get on a Roche machine rather than being moved to this other lab that may have Abbott capacity, because they're all in different laboratories. And so I think, well, actually, Admiral Giroir is figuring it out to really create some kind of visual so that every governor and every health commissioner can see all of their capacity in their countries, in their states, county by county, so that they know where the tests are. So we pushed a lot of tests out, but they're not all being utilized.
And it's up to the people when they don't send them back. They use them, they don't send them back. And Doctor, go ahead, please.
No, Dr. Burks explained it very, very well. I just want to get back, John, to your question. It's a logical question. When you look at the number, you want to know what the demography is going to be. This is a number that we need to anticipate, but we don't necessarily have to accept it as being inevitable. And that's getting back to what I'm saying about, we can influence this to a varying degrees. And if we influence it to the maximum, we don't have to accept that. That's something we need to anticipate. But I want to do, not I, all of us want to do much, much better than that.
On that front, what do the models suggest is on the low end if you have full mitigation?
Well, it says
That was
between
full
100 and
mitigation.
200.
That was full mitigation.
All right, Trump is talking. We're not going to him. I want to go to my first guest because I'm just not understanding what in the hell we just heard. Joining us right now is the president of the American Medical Association, Dr. Patrice Harris. Dr. Harris, I'm sorry. If I'm frustrated because of what I just heard, this is what I don't understand. I recall there being a Rose Garden news conference where CVS and Walgreens and Walmart were walked out there and we were going to have drive-through testing and all sorts of stuff. And then hear Dr. Burke say, oh, we've got 500,000 tests that are in the states that nobody's using. And then you hear Mike Pence say, well, there's a misunderstanding. We're doing 100,000 tests a day. But then you hear the governor of Montana say, don't have enough tests. you hear the governor of Ohio, don't have enough tests. And so, I'm sorry, is there some sort of disconnect between what D.C. is saying and what is actually happening in the rest of America?
Well, Roland, thank you for having me on the show. And you used the perfect word, the word I was thinking about, and that was disconnect. So we are absolutely way behind on testing. And we have asked at the AMA for some sort of national tracking system so we can know exactly where these tests are, because you're right, it's hard to say. And early on we heard millions, and now we are saying there's 500,000. And I think it's incumbent upon the administration to develop that tracking system, that tool that Dr. Birx, I believe, was just alluding to. That has to happen. Otherwise, there will still be that disconnect. Governors and states will still not have the information that they need and the testing capacity that they need. So
I hate Excel spreadsheets, but to me, I don't understand how hard this is. Again, what I don't understand is if you say we sent 500,000 out, okay, how many went to Ohio and went to Florida and Illinois and Tennessee and Georgia? So let's say you sent 50,000 to 10 different states. Okay, then who did you send it to in Florida? Who received it in Florida? Was it signed? And then did they distribute them to counties in their state? I don't understand why this is so hard. And then we were told, I remember, we're going to have 4 million by the end of the week. And then you hear the vice president say, well, that was a misunderstanding. And, saying that there's 1.1 million. That's the difference between 1.1 million tests being done and then them being returned and people don't return them. Well, guess what? If you had drive-through testing, you wouldn't have to have people not returning them because they would be tested right then, placed in a bag, information taken, and then sent off. Correct?
I agree. You're asking the right question, and that's why we have to demand a tracking system. You're right about spreadsheets. I believe, Roland, and I'm not that tech savvy, but it appears to me that some very smart tech savvy folks could develop something relatively quickly. We have to know where these tests are, who has what, who needs what, and then we can prioritize the need. And by the way, we have said that regarding the ventilators and PPE. I mean, we really need a federally coordinated tracking system because you're right, these questions should not be that difficult to answer. And it just, underscores that we are not matching the demand of governors, of states, of local county health departments, and we really need to do so. And testing is a critical way we are going to know the exact spread of this disease.
One of the things that, folks, let me know if y'all have that video. Someone posted a video of what hospital workers are literally going through to protect themselves from coronavirus. If y'all have that video, can you please play it right now? Okay, all right, y'all, find the video. I asked for it to be downloaded, and so please, and what's really just again crazy to me, and I'm going to try to find this video, and it was unbelievable to literally see all of the stuff that doctors are doing and what they're having to deal with, and then you listen to Donald Trump stand there and essentially accuse people of stealing masks and them going out of the door and then questioning, well, why they need ventilators. I read a story last night where in Miami at a Veterans Administration hospital, they are telling people they are going to have to use 1 mask a week. You're a doctor. That's not even the CDC protocol. You're to get rid of that mask after you've seen 1 patient.
Roland, this is the most common concern I am hearing from physicians all over the country. And I know everyone, you've seen the nurses wearing trash bags. And as you say, you've seen physicians reusing masks, trying to sterilize them themselves. And Roland, in typical times, and we are not in typical times, but physicians would have been disciplined or fired for reusing masks because it would violate infection control policies. So again, physicians, we went into this profession accepting some level of risk. You know, this isn't the first infectious outbreak we'll have, and this won't be the last, but there's an accountability contract here. You know, we should have the tools that we need. We should have PPE that we need. It is just unconscionable that we do not have the PPE. And again, another reason the AMA requested of the president to invoke the DPA. Now, this was 2 weeks ago or several weeks ago, and he finally did do that because we need massive amounts of PPE, and it is being used, and it is not being misused, according to the physicians that I'm hearing. They are just trying to do the best they can, and they don't want, candidly, to be infected or to become ill. They don't want to risk their families becoming ill, and it's really not selfish, you know, because if physicians and nurses and we lose other healthcare professionals on the front line, what are we going to do? Who's going to be there to take care of our patients? So this is certainly a workforce issue. It's tragic, and I will tell you, physicians tell me that they go to bed at night sometimes in tears. And we're going to get up the next day and do what we can, but we really need to get PPE in the hands of those who need it. And it's about results. You know, it's okay to talk about it. But the metric for the AMA will be results. And when we don't have the video, I know, or the trash bags or folks reusing them, then we will know that we have the results that we need.
When you talk about hearing from these various doctors, we're seeing people who are posting their own shots. We're seeing photos of doctors literally sleeping in their cars because they are afraid to go home and possibly infect their wives and children. I saw one tweet earlier where this woman, her mom was a retired doctor, and then they call her back into action, said, here are all of the important papers, here's all of the will information, I might not survive this. I mean, we are hearing from doctors who are saying that they are operating in war zones, and you juxtapose that with these daily news conferences, and you hear folks say, we got enough ventilators. But then I read one story where one woman was 90 years old, and she said, look, don't even bother, save it for somebody younger, and then that woman died. That took place actually in another country, but we're seeing people make those type of decisions. You talk about the National Defense Production Act. I read another story from the Texas Tribune where there was a particular supplier who has 2 million masks and said they would sell it to a hospital for $6 a mask. They normally cost $1. And yet you have Donald Trump, who's just walking people up there saying, oh, this company is going to produce 50,000 a week, and this company, how great is this? If you invoke that, you can actually use the hammer to say, no, you cannot price gouge. And so even though he signed it, they're actually not really using it. And so, as Cuomo said, now you got hospitals competing with one another, saying, fine, how much you going to pay? Well, you're going to pay $6, so forget you. Oh, you'll pay $7, forget you. This is not the way you operate in an international pandemic.
You know, Roland, physicians are writing wills. They are, and as you mentioned, living away from families. But just think about that. Actually, they are updating their wills and rewriting the wills, and I think that just speaks to and underscores the need for federal coordination of this effort again. And so we again continue to call on the administration to use all the levers, as you mentioned. You've mentioned several. In the federal government to make sure that we have the supplies that we need, and it's coordinated. So hospitals are not competing with one another, states are not competing with one another. I believe that, and then we have this tracking system, so we know. You're right. Perhaps right now we all know that New York is the hot spot. Certainly, New Orleans has a great increase in cases. Last week, I live in Atlanta. Last week, our ICU beds were at near capacity. We know the peak is going to hit different regions of this country at different times, and there could be federal coordination. Absolutely, we need to increase the baseline of ventilators, but there could be coordination. But certainly, it would be great if the federal government, and we are requesting that the federal government step in and make sure all of these needs are coordinated so that priority areas get what they need. This is going to affect us all.
You're the president of the nation's largest medical group. Has this task force, has this White House called in the AMA and say, what's your advice? What's your counsel? What are your members saying?
They have, Roland. I will say 3 weeks ago, I, along with the leaders of other national medical organizations, had a conference call with the task force and the president. And we raised this issue, and it was my suggestion coming from the AMA. Of course, there was really a lot of consensus among all the groups, and we raised the issue of the need for PPE. We raised the issue of the need for testing at that time, and this was about 3 weeks ago. And so these are issues that we raised. Now, and I will say this, the CMS, the Centers for Medicare and Medicaid Services, have been very responsive around the issue of telehealth. And that has certainly really helped a lot in making sure that patients still have access to care. As you know, many physicians' offices are closed, elective surgeries postponed. Maybe the offices are, 1 to 2 days, hours are different, but we have been able to meet some needs, not all, with the use of telehealth. So certainly there was some responsivity to that. But really, PPE continues to be an issue. The testing, as you know, continues to be an issue. And from our standpoint, the AMA and the nation's physicians, again, it's about results. We can talk about it, but we need more than the talk. We need to make sure that we have results. And again, the metric for us will be when we no longer hear the stories or see the videos that you mentioned of nurses and doctors not having the equipment that they need, or for that matter, be fired for using their own equipment. We really needed all hands on deck approach for this. And look, physicians are going out on the front lines, nurses are on the front lines, and we need accountability back for us to say, yes, you are going out on the front lines, and we want to make it as safe as we can for you, for patients' sake, for your sake, for our healthcare system's sake.
Last question for you. I know that call was 3 weeks ago. But here's what we're also hearing. And I got a couple more questions. I'm going to ask this one first. It is baffling to me to listen to reports of hospitals threatening to fire personnel if they talk to the media about problems inside of the hospital. I would think that this is the last of all moments. This is not the moment where you want to be firing personnel in the middle of a national emergency.
Roland, yet most institutions have a media policy, and that is in the service of coordinating, what is said. But these doctors are speaking out and saying what everyone already knows, right? That we don't have PPE. They don't have PPE. So again, AMA...
And also, for the person at home, you said, what is PPE?
Yes. PPE is personal protective equipment.
Got it.
And that's the masks, the face guards, the gowns, and those are the N95 masks, the gowns, all of that equipment, which again reduces the risk of a physician becoming infected or infecting another patient. So again, appreciate media policies, but these physicians are going out and really saying what everyone already knows. And so we do not believe that, absolutely do not believe physicians or any other worker should be fired.
Last question. If you talked about being on that call 3 weeks ago, if there was one thing that should be done right now by this task force, by this White House, with the federal apparatus, as opposed to just leaving up to the states, what would you say that one thing is?
Well, I would say the federal coordination and a tracking system and the data, and really that's an umbrella, and then it takes care of all the other things we need. Tracking the PPE, making sure, again, as we started this conversation, we need to know. We're glad that Abbott has that new test out, 500,000. Where is it? And let's make sure we get that out to folks so we can act on the data. If I can say one last thing.
Yeah, go ahead.
Data and the science and the evidence is what needs to inform our interventions and the next steps. And without the data, we won't know where precisely to target our interventions. And I just want to say one more thing about health disparities and health inequities. One other piece of data is we believe that, and again, we need to not only know gender, we also need to know race and ethnicity regarding those who are impacted, those who are hospitalized, those who have died. We know something like this just magnifies already existing health inequities. And so, again, we need the data to inform our next steps.
All right. Dr. Patrice Harris, President of the American Medical Association. We certainly appreciate you joining us. Thanks a lot.
Thank you for having me.
All right, then. Folks, I have the video here that was just stunning. Rex Chapman posted this video, and I mean, this is, they fast-forwarded it, but watch what one worker goes through to protect himself from coronavirus. Watch this here. Unbelievable. Mask, netting, goggles, then a second hair net, if you will, gloves, protective suit, goes all the way up to the neck. It's a hood. Now it's a third one. Then he tapes the side of it. First of all, another pair of gloves. Booties over the shoes. Now he tapes the side of the, and then puts a mask on top of the mask. And now he's ready. That's what one hospital worker does to protect himself from the coronavirus. And Donald Trump says, hey, just reuse the mask. Just reuse it. I don't see what the big deal is. Just reuse it. This is the utter silliness. And this is why I don't take these news conferences live. Not only that, I don't take them because, y'all, he lies. He lies. This is what he said 3 days ago.
By this disease, whatever they want to call it. You can call it a germ, you can call it a flu, you can call it a virus. You can call it many different names. I'm not sure anybody even knows what it is. But the children do very pandemic by this disease.
He says you can call it a flu. Today's news conference, he says it's not the flu. Then he says no one knows what to call this. Yes, they do. It's called a virus. It is baffling to look at the level of dishonesty that we hear every single day. And this thing is real. It's real in how it's impacting people. Vice President Joe Biden continues to draw attention to Trump's massive failures.
You've said repeatedly that you think that some of the equipment that governors are requesting, they don't actually need.
When I hear face masks go from 10,000 to 300,000 and they constantly need more.
Is there an action he has not taken that you would be taking right now if you were president?
One, I would make sure that he uses the Defense Production Act for masks and gowns, all the things that our first responders and our doctors and nurses need.
Somebody should probably look into that, because I just don't see from a practical standpoint how that's possible to go from that to that.
Why are we waiting? We know they're needed, and so I would be moving rapidly.
Something's going on, and you ought to look into it as reporters.
Look at what's happening here. You have nurses showing up wearing garbage bags as over their bodies as protection.
Where are the masks going? Are they going out the back door?
We need to get them the help they need right away.
There's something going on. Well, it's not. I don't think it's hoarding. I think it's maybe worse than hoarding.
And yes, Donald Trump still doesn't get it. Doesn't get it.
It's going to disappear. One day it's like a miracle. It will disappear.
The frustrating thing about all of this is it really just feels like it's too little too late. Like we knew it was coming.
The risk to the American people remains very low.
We had to get a refrigerated truck to store the bodies of patients who are dying.
When you have 15 people, and the 15 within a couple of days is going to be down to close to zero, that's a pretty good job we've done.
Yeah, that's the cough.
People are getting better. Almost everybody that we see is getting better.
The hospitals look like a war zone.
People come in, they get intubated, they die, the cycle repeats.
So I would love to have the country opened up and just raring to go by Easter.
This is for real. Please stay inside. Please pray for the people, y'all.
Everybody is getting better. Really? Look at these heartbreaking tweets from people who've lost members of their families. From the Fab, my aunt died yesterday. Her daughter died today. My cousins lost their mother and grandmother to COVID-19 in less than 24 hours. From Kirsten Allen, my uncle was tested positive for COVID-19 last week. By Sunday, he was hospitalized and on a ventilator. This morning, my cousin let me know he didn't make it through the night. As the president fiddles, people are dying. Also, go to my iPad, please. This video here, State Representative Isaac Robinson of Michigan, member of Phi Beta Sigma. Yes, he is white. He's a Sigma. He actually, 44 years old, contracted coronavirus. He also died. Statement from the Senate Democrats: we're absolutely heartbroken to hear of Isaac's untimely death. Isaac was a fighter for his district and proudly carried on the family tradition of advocating for the working people of Michigan. This is just terrible news, and we will hold the Robinson family close in our prayers tonight. I was looking at a story before I came on the show. Adam Schechter of ESPN posted this particular tweet. There's a sports agent who represents several NFL players, Buddy Baker. He posted this yesterday, 2 hours ago. He lost his mother and father to coronavirus. Go to my iPad, please.
Contracted COVID-19 and unfortunately passed away this past Sunday due to complications. My parents were amazing people. They were married 51 plus years. And they passed away 6 minutes apart. Just a few weeks ago, they were in perfect health. We live in a world of it can't happen to me, it can't happen to us, it can't happen to my family. But what happened to us? I'd like to take this time to make people start thinking about making a change. While the CDC and all the regulatory bodies make suggestions on what we should do, I'm not sure everyone really understands the importance of it. Hopefully this can be the catalyst for a change. Practice social distancing, wash your hands as regularly as you can, and importantly, stay at home. This is an opportunity for something which was very bad and tragic to my family to prevent someone else's. Sometimes people can, especially young people, can feel like they're immune from something, we're invincible, and that's simply not the case. It's not the easy choice, but it's the right choice. It's the safe choice. So during this time, realize it's boring to stay at home and you're not going to be able to live life as we've grown accustomed to. But it's necessary to help fight and stop the spreading of this horrible virus. As part of my job, an essential quality is the ability to lead, some might say inspire others. Well, we usually look for a positive thing to be an inspiration. We hope that what's happened to us and our family inspires others to start leading and unifying with each other to make the right choice and the challenging choice. Again, it's going to take...
All right, folks, let's bring in my panel. Melik Abdul, Republican strategist, Kelly Bethea, communication strategist, Teresa Lundy. She is principal founder, TML Communications. Just a short while ago, Melik, this is just one of the reasons why I don't waste time listening to Donald Trump from this news conference. Literally just a few moments ago, 8 minutes ago, Mike Pence stood at the microphone and said every state should comply with the 30-day clampdown. Donald Trump walks up right behind him and says states like Florida and Ron DeSantis should do what they want to do. Dude, what the hell? What's the whole point of the leader of your team?
You know, whatever information, I think that the governor, and many people would argue realistically that he waited a little bit late to actually implement things down there in Florida, specifically as closing the beaches. But I think that the 30-day timeline, from my perspective, it pretty much speaks for itself. And it's a guideline for states. Obviously, it's, I don't think that the federal government at this point is mandating that. But as far as the general guideline, in addition to the things, I think probably, 2 weeks ago, when they gave us the 14-day quarantine guidelines, I think this is just another extension of that, and it makes sense for states to follow, but not just the states. So, you have places like Virginia. Forget what the federal government guidelines are. There are many other states that are moving towards extending that well beyond April 30th. So I think we should make a distinction that these definitely are guidelines for states to follow, but many states like Virginia and some other states, Maryland and other states, they're not going to abide exclusively by that guideline.
Teresa, here's what's stunning. Here's just what was stunning. To listen to Donald Trump stand there and 3 days ago say, well, this is like the flu. And then today, not the flu. And then if somebody said, but 3 days ago, he probably would say, oh, you're a liar. You're being snarky for reading bad comments. I mean, the reason why people are saying don't take his comments live, Teresa, because he lies. He literally makes shit up. And then you got to come back and correct it over and over and over again. He has not taken this seriously, and it has been awful. We lost Teresa. Let me go to Kelly.
Hello?
Kelly, go ahead.
No, regarding your question, it's beyond awful for me, and I'm taking it as seriously as I can and as personally as it is to me. I am considered an essential employee, so there may be a time where I have to go into the office, but until that point, I'm not going in. I'm working from home as best I can. I have people in my life who have died, attenuated people in my life, friends of friends. Just got a post on Facebook 2 days ago, or yesterday rather, that a friend's fiance, he was 32 years old, in perfect health. He had diabetes, and as a result of complications from that disease, he died of COVID-19 at 32 years old. And while people will say, oh, well, he had complications, or, in other cases, this other person had complications, you should not have to, you shouldn't be dying because of a cough. You shouldn't be dying because somebody shook your hand. that's crazy. That's not how this is supposed to work. And the fact that our president just is blissfully and willfully ignorant of the fact that this is an emergency. We are in dire times right now. We have not seen this in our lifetime before. And he is just taking it like it's a grain of salt. It's just insulting, and I'm frankly ashamed that he's our president. This is a shameful moment in history when it comes to the American presidency, that we don't have a president who cares about his people, disrespecting reporters who are asking him the tough questions, not having any accountability partners when it comes to these ventilators and equipment that these doctors need. It's ridiculous, and it is really just shameful.
Teresa back? Say it again, she's not there. Is Teresa there?
I'm here.
All right, there we go. All right, Teresa. Again, Teresa, as I'm looking at these stories, as I'm seeing what's happening, I'm listening to Trump whine and complain about the mask and things along those lines. Yet I'm looking at this story out of Miami. A Veteran Affairs, they're telling them you can only use one mask per week.
I've never heard anything like it. I have to go back to your original point where we have to really realize that we are dealing with a president that is a business guy. So his first reaction was about the job markets. His first reaction was about the business community. Oh, it's not a big deal. Okay, give me some talking points just so we can probably contain, the virus and not make it as widespread or a pandemic, because we all have our interests. Donald Trump was elected on being a business guy, and so his mindset is about business first opportunities. And so when we see him go from February's press conference from 15 people to now we have 26,000, upwards to 500,000 of testing that hasn't been used yet, the American people really have to start reading for themselves, right? Because we love Dr. Fonzie. We love, the other CDC directors. We love President/Governor Cuomo. But we have to be realistic that some of the supplies are limited. Doctors are utilizing trash bags, Ziploc bags. I've had two friends literally in the past 2 weeks just told me that their uncle died and their brother just passed away because of COVID. And so here in Philadelphia, we're doing what we can, and our numbers aren't as, thank God, high as New Jersey and New York, but we have first saw increasing results in the counties that's literally 10 or 20 minutes away from us. So it does behoove every city and every county to know that this virus is here and start taking precautions early. And that's what I believe every mayor's responsibility is. But at the end of the day, when we are looking at these live press conferences, we have to take a more intelligent and educated look into what's actually being said. Because if I just heard in this live press conference, Roland, forgive me if I'm mistaken, but I was told we had about 4 different testing.
You froze there, so hope we'll get Teresa back. I'm gonna read this story here. This is from the Miami Herald, Melik. Miami VA hospital employees are being told to reuse one surgical mask per week. Healthcare workers at the Miami VA hospital are being told to reuse one surgical mask for a week at a time starting Monday. Guidance issued after a federal report on VA hospital preparedness for the novel coronavirus pandemic found the facility had shortages of personal protective equipment. Administration officials at the Miami VA told employees to check out a surgical mask and return it at the end of each week in order to receive a new one, according to people familiar with operations at the hospital. A spokesperson for the facility confirmed the guidance on Sunday, but said it applied only to employees who are not dealing directly with patients suspected of having COVID-19, the disease caused by the novel coronavirus. Shane Suzuki, the Miami VA spokesperson, said the guidance was issued out of an abundance of caution. Malik, Donald Trump constantly pimps the military, talks about how he loves the military and all the money we've spent. There's extra $700 billion in the bill that Senator John McCain put forth. The billions and billions. He flew down to Norfolk, Virginia, just to see the hospital ship away and hold a news conference. How in the hell do you actually give a damn about the military if these are the sort of things happening at a VA hospital?
Well, I don't think that the fact that they don't have enough protective gear, I'm pretty sure it has very little to do with Donald Trump, as opposed to just unfortunate. It's an unfortunate thing about our government. If we look at what the experts have said, what Fauci have said, what even medical experts have said, what former government officials have said, is that this is something that is definitely unprecedented. And we're seeing that there are definitely gaps in the system, not just on the federal end, but our public health care system. Governor Cuomo just said today that there are things that they're learning in real time as far as the New York state health system that they just simply did not know.
But Malik, to listen to Mitch McConnell today, Mitch McConnell try to blame Democrats by saying they were focused on impeachment. Would you like for me to show you how Donald Trump was not caring and focused on this in January and February? How he was holding rallies, how he was tweeting about other things, how literally for nearly the entire month of February, he made no mention of any of this in the month of February in any of his tweets. Had the United States actually used the month of February and the first week in March to actually mobilize, we would not be in the situation, Malik. And so that is a failure on leadership.
Well, I simply don't. I don't know what you're using to draw that conclusion.
I'm using facts. I'm using actual. Okay, hold up. You know what? Hold up. Since you're asking, what am I using? Okay, guys, I want y'all to cue the video we just showed. Since clearly you're asking the 1 minute and 15-second video. Okay, cue that video, and then Malik, you respond to this video since you're asking me, you don't know what I'm using